Welcome to MCC's Virtual Hospital on the Go. Today's topic is cerebrovascular accident, also known as a stroke. CVA is damage to the brain due to interruptions of blood flow. This is an emergent event and requires immediate medical attention. The point of today's video is to take you through the nursing process as it pertains to cerebrovascular accident. This is Mr. Frank. He had a cerebrovascular accident 12 hours ago and has been on the med-surg for the past 6 hours. The nurses have determined that the highest priority nursing diagnosis as impaired physical mobility related to ineffective cerebral tissue perfusion.
Hi, Mr. Frank. I'm Perry, and I'll be your nurse today.
And I'm Sabrina. I'll also be your other nurse.
Mr. Frank, let me pull up your chart real quick. Mr. Frank, I know your nurses from the other shift did a full head-to-toe assessment when you arrived at the unit, but we are going to take a more focused look at some of the things that may have been affected by your CVA. Mr. Frank, can you state your full name and date of birth for me? Great. Do you know where you are currently? Do you know what year it is? Do you know why you are here? What would you rate your pain today? Asking Mr. Frank these questions would give us an idea of his level of consciousness. Mr. Frank, I'm just going to document quickly in your chart. Sabrina, while I do his focused assessment, would you mind getting his vitals, focusing on his temp, blood pressure, pulse rate, but also getting his O2 sat and respirations?
Yeah, I'll do that.
Great. While Sabrina does that, I'm going to look at Mr. Frank's eyes, assessing for Perla. Then I'm going to assess his cap refill and turgor. Mr. Frank, can you feel this? I'll document my findings. Next, I'm going to assess his range of motion. And while I assess the upper and lower extremities, I'll check for his brachial, popliteal, posterior tibial, and dorsalis pedis pulses to make sure they're equal and bilateral. Additionally, I will be checking for any edema, abrasions, ecchymosis, and pallor. Next, I'm going to assess his heart sounds. Okay, great. Mr. Frank, can you swallow for me? We're also going to monitor his input and output and conduct a Braden scale assessment. Sabrina, I've documented everything. After doing a focused assessment on Mr. Frank, as well as a neurological assessment, the 6 P's of pain, pain, pallor, paresthesia, paralysis, pulses, and pressure, he seems to have limited mobility on his left extremities, both upper and lower. He's exhibiting difficulty swallowing and has some tingling in his feet. Sabrina, what do you think our plan of action and goals are for Mr. Frank?
Okay, so first, I think we should put in a consult for physical therapy and occupational therapist, and to improve his mobility and prevent aspiration. We would recommend the doctor to order an assistive device such as a walker or a cane, and we also need to assist on teaching him how to use it. We will set up a consult with the dietitian so Mr. Frank understands what a heart-healthy diet is, and we will also assess for his hygiene and for skin integrity, since there's a lack of movement and he'll be at risk for that. And Mr. Frank, We'll be back shortly to explain your whole plan of care, and we'll see you later. Okay, so Perry, now that I have set up the plan for Mr. Frank here are the goals that I think we should set for him. I think Mr. Frank will ambulate once around the unit without rest by discharge. Mr. Frank will return demonstration of proper use of his walker by discharge. I want him to not aspirate anything during hospital stay. Mr. Frank will identify at least 5 heart-healthy foods by the end of his shift today. Our shift today. Mr. Frank will be without pressure ulcers by the end of the hospital stay also.
Great. So Sabrina, what type of nursing interventions should we do to make sure Mr. Frank meets his goals?
We will make sure to change his position every 2 hours. We will be doing range of motion exercises, teach him how to maintain balance in a seated position also. We will need to be consistent with his activities. We will also need to assess his Morse scale and his Braden scale. We will need to make sure his skin is properly moisturized and that when he is going to the bathroom, he displays appropriate hygiene also. We will also need to teach Mr. Frank how to appropriately ambulate with assistive device. And we want to educate him what is included in a heart-healthy diet, which can include whole grains, fruits, low-fat yogurt, salmon, nuts and seeds, legumes, and lean ground meats.
Right, and we'll also want to make sure that we put in a call to PT and OT and dietary as we discussed with him earlier.
Yes.
Alrighty guys, so how are we going to evaluate Mr. Frank's progress?
Well, we're going to do a Braden and Morse scale daily. We're also going to assess his ability to identify heart-healthy foods.
And we'll assess for improvement of swallowing, assess for improved strength with range of motion exercises.
Also, we'll want to assess the maintenance of his skin integrity, and then if there's any relief for his sensory deprivation, and then assess for improvement in his physical mobility. If all of these goals are met, then we have been successful in our care plan. If we do not, we will have to reevaluate and adjust the care plan accordingly.